Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome to the Hair Loss Show, episode number 43. And today we're really fortunate to have a live demonstration of a patient from the channel who's agreed to come in and basically demonstrate what's been going on and how we manage things. So Jürgen, thank you very much for coming.
Yep.
Thanks for sharing this with everyone. I think everyone will find this quite useful. And the goal of this is actually just to use you as an example, just to show what it is you're looking to achieve and what are the things that we can do. So Jürgen and I had a chat a few minutes before we started taping this. And you're 34 now?
I'm 34 now.
And you started losing your hair around about the age of 25, you
25,
said?
yeah.
And who in your family has lost their hair?
I think just a few of us. Yeah.
Yes,
Yeah.
okay. And I mean, remember when I saw you first, you came and you wear a baseball cap
Yeah.
because you've been losing your hair and you're not happy with what you got,
Yes,
is that right?
yes.
Okay. And so what is it that troubles you the most with your hair? What are you looking at achieving?
I'm looking to achieve I obviously want to prevent my hair loss.
Yes.
Because sometimes even in my daily activities, sometimes we become stressed. So I just want to prevent my hair loss.
Sure, you want to stop it from getting any worse.
Yep.
That's fantastic. And so, yes, you said you've been losing hair since the age of 25, but do you think it's been a gradual hair loss over the last 9 years, or is it increased and now stabilized? Where do you think you are right now with your hair loss?
I think it's a gradual hair loss.
It's a gradual hair loss.
Yeah.
And what have you been using in terms of treatment, or have you tried anything?
Yeah, I tried to use minoxidil.
Yes.
I tried to use it for 2 months, but
So for 2 months?
Yeah, for 2 months.
Yeah, and then how did you find that?
Because I'm being inconsistently using minoxidil, but so I am looking for a different option.
Right. When you say inconsistent, so you're using the liquid or the foam?
I think it's liquid. Yeah.
The liquid.
Yeah.
And how is that? What's your experience with using it? When you were using it, was it okay, or was it, you didn't like the way it was?
I didn't like the way it was because sometimes you need to apply it morning and evening, and because of my job, so I'm very busy sometimes, so I don't have time if I put it in the morning
And so you're skipping days when you're
skipping days. Sometimes
Right.
I put it twice, and
Yes.
sometimes not.
Not okay. And did you know? Was it greasy? Did it make your hair greasy at all?
Yeah, a bit of.
A little bit. Okay. And so sometimes when we've talked about minoxidil in the past, we've said that some people experience a shedding. Did you notice any hair loss? Did it worsen when you were using the minoxidil at all?
I think in my first week,
Yes.
it's become worse.
Yes.
Yeah. Something that I'm not expecting, but
Yes.
yeah, it becomes worse.
Okay, all right. And so going back to things you said, from your perspective, ideally you want to stop this from getting any worse.
Yep.
Are you happy with the hair that you've got, or you'd like more hair in an area? I know everyone says they want more hair, but are you happy to maintain things, or would you like more hair?
I would like to have more hair.
You'd like to have more hair. And whereabouts would you like to have more hair? Anywhere particular, or just generally?
I think it's in my hairline and the one on top.
So if we look at your hairline, are you happy with, you've got a bit of a receding hairline, that's a mature hairline.
Yeah.
Are you happy with the shape of the hairline, or would you like to change the shape at all?
If it can be improved a little bit, then I'm happy to do it.
Okay,
But,
all right. Okay, good. So let's have a look and see what we're dealing with. So again, I'm really grateful for you to come and share your experience with everyone, because I think in the past we've done patient demonstrations, we've used photos, and that's really good, but to be able to see you and then show people exactly what we're doing, I think that's really valuable. So thank you very much, first and foremost, for doing that. So if we look at Jürgen, the first thing we'll start off by looking at is the hairline. So Jürgen's got what we call a mature hairline with recession into the corners there, and that's age appropriate. It is age appropriate for someone in their mid-30s, but also slightly older. So again, if you were looking at the face and the framing of the face, you probably say, like, potentially you could thicken that area up and reduce the recession in the corners, and that will probably potentially frame the face better. But if we, again, coming back to Jürgen, can I get you to bend your head down for me? If we look at Jürgen, I'm just going to part your hair slightly. You know, he's got the existing hairline, but he's quite thin behind that through this upper mid scalp, and then just bend your head down further and into the crown area as well. And what Jürgen's done is he's combed his hair, he's kept his hair a little bit long so that he can comb it back and then effectively camouflage that area. So if we were looking at, in terms of trying to classify you, I'd probably say you were probably around about a Norwood 4 type classification, but you've got some density through that upper part of the scalp. So if you're going to thicken, you just want to thicken that area. All right, so we're going to have a look in a little more detail at Jürgen's scalp. So if we look at the back of the head, all right, what we can see here, this is a video microscope, and it's got 50 times magnification of the back of Jürgen's scalp, and this is normal scalp, normal skin, and normal hairs. And what we can see is that the hair shaft is nice and thick, nice and dark, so it's got a lot of pigment in it, and you can see that the hairs are coming out in groupings. These are called follicular units, and so most of the time it's coming out 2 at a time. There's occasionally 3 at a time as you move through. There's the occasional small, finer miniaturized hair, but generally most of the hairs look nice and thick, so that's normal. Then if we come up into the crown area, we can compare how the difference there, and we can see that in this area, this is where the effect of miniaturization has taken place, and we can see that the hairs are now a lot thinner, finer, wispier. They're generally coming out 1 at a time, potentially 2 at a time. There's sometimes you can notice there's larger gaps between the groupings, but generally the hairs are finer, they don't have as much pigment, and there's a reduction in numbers as well. And if we come up into the upper part of the scalp, we can see the same effect. The hairs are coming out 1 at a time. There's still some dark, but they're looking finer and wispier, and there's larger gaps between the hairs. So this is effectively what miniaturization looks like and what we look for to diagnose male pattern hair loss. We talked about medical therapy, so we looked at stimulation therapy, and one of the problems that Jürgen's having is he's not being consistent with stimulation therapy. He doesn't like the use of the minoxidil twice a day. So the first thing I'd say about that, Jürgen, is that probably with the minoxidil you could probably use once a day. You don't need to use it twice a day. So if that makes it easier to be more compliant with it, I think that would be great. Yeah. If you find it's a bit too greasy, then potentially switching to the foam is another option as well. So minoxidil comes as a liquid, it also comes as a foam. So maybe the foam might be a little bit easier to handle, it's less greasy, and then you just need to apply it not to the hair but to the scalp in that area to try and stimulate the hair in that area. But the reality is, in order to try and stabilize the condition, we're going to start on some finasteride, and we talked about finasteride with you before, and we've discussed finasteride quite a few times on this channel. It's basically trying to block the conversion of testosterone to dihydrotestosterone, and generally I would start 1 tablet 3 times a week. So giving you the prescription for that. So basically go to the pharmacy, get that, and get started on that, and the risk of side effects are probably quite low with that, so generally less than 1% or slightly less at that dose. So start taking the finasteride, and then carry on with the minoxidil, and we'll see if we can thicken that area up. We're going to demonstrate as well the miniaturization and what that looks like on Jürgen's head in a few minutes. But let's talk about the next plan. We're gonna have to see how it goes with the medical therapy and with the finasteride, and a combination of the finasteride and the minoxidil, and it'll probably take us a good 6 months to see how effective that is. But the reality is we have to set our expectations. And I spoke to Jürgen, I said, look, the key here, and I mentioned this to you, is that it's about the medication is going to stabilize the condition, stabilize the hair loss. It is not going to give you more hair in this area. And so we spoke about that before, and you mentioned that you actually wanted to add more hair to the area. Is that correct?
Yes.
Yeah. So if you got someone who's got this sort of diffuse thinning through the top in a sort of Norwood 4 pattern, really the only way you can add more hair to an area, the finasteride and the minoxidil are not going to do that. You're really going to have to look at a surgical option. So having a hair transplant. And a hair transplant is effectively moving hair from one part of the scalp to, in your case, the top and the front. And we can probably thicken through there and maybe blunt off the corners and then round off that hairline. We don't have to bring it down too low, but just bring it, blunt off the corners a little bit there. And to do that, probably is going to take about 1,500 grafts, depending on where we draw the hairline in the corner, but generally to thicken through there, maybe blunt off the corners a little bit, roughly around about 1,500 grafts, which is probably around about 3,500, almost 4,000 new hairs that will come through that area. Okay, so that's essentially surgery. If we talk about technique, with hair transplant surgery, there are obviously two surgical techniques. There's FUT and there's FUE. FUT is where you cut the strip out, and FUE is where you punch out the grafts one at a time. And I had a chat with Jürgen, and probably in my opinion, probably you'd be best suited to the FUT version, the strip technique. The reason being is that Jürgen started losing hair relatively early on in the piece, so at age 25. And he's now 34, and he's at a Norwood 4. We don't know what the end point for him is. Is it at a Norwood 4? Is this going to get worse? The idea is that we've started on the medication, as we discussed, and that will hopefully stabilize things. But we have to plan that you potentially may lose more hair. And if that's the case, we've got to be prepared to come back and transplant more into an area. So that sort of helps decide which is probably the best technique. And if that's the case, probably taking a strip, a linear incision, and taking a strip from the back of the scalp will probably help in future planning, that we can do further strip and potentially FUE again if we need to come back and harvest more hair. Because if we did FUE in this scenario at an early age, potentially we may deplete the donor zone a little bit too much. So I think on balance, you could go either way, and there's an argument for doing FUE. I'm open to that as well. But I think in principle, looking at the age group where you are and the history and the path that you've had, might be better to do strip as a first line procedure. But at any rate, I think surgery is further down the track for you if you're going down that road. Start on the medication, and then we can see how you progress that, and we'll assess things at 6 months' time. Yep. All right. Are there any questions you want to ask? I know we had a chat about things off camera, and so we went through things anyway. This is for purposes of the channel, but is there any other things that you want to add to the discussion at all?
No, so far.
That's good. All right, perfect. Well, first of all, thank you again for me. I'm very, very grateful. I'm sure everyone's grateful that you've sort of taken the mantle and come and do that. That's very brave of you. So I appreciate that, and I hope everyone will acknowledge that and appreciate that. Thanks very much for watching, and we'll see you. I hope you find that useful. Please give us a like and a thumbs up, and please subscribe to the channel, and we'll see you on the next episode. Thanks very much.